And listen to this, 1 in 10 people in Louisiana suffers from asthma during his or her lifetime. Immunologist Dr. Reena Mehta from Uptown Allergy and Asthma is here to talk about what we need to know in identifying and treating asthma. Good morning.
Good morning.
So what happens to your airways or your lungs when you have asthma?
So asthma is a process of inflammation, and so there's swelling in the lungs. And when there's swelling in the lungs, that leads to constriction of the airway, and it's difficult to get air in and out.
And the numbers are staggering. You said the 1 in 10, 5% of school kids in Louisiana miss school?
Right, so we are above the national average when it comes to asthma, unfortunately. So in 2011, more than 5% of children in Louisiana reported missing school because of asthma. So that just highlights that it affects our day-to-day activities, such as going to school and going to work.
You know, one of the catalysts apparently was Katrina, and there was more mold after Katrina.
Exactly. So, really, asthma has been more highlighted after Katrina because of the high mold levels, everything getting kicked up. And then once mold levels get kicked up, it just stays in the air. It's difficult to get rid of.
Does a person outgrow sensitivity to mold? If you have an issue at age 4, by 24 you're fine, or how does it work?
No, actually no. So unlike food allergy, what many people can outgrow, environmental allergies most people do not outgrow. And so once you get the sensitivity, you do not get rid of it.
All right, so the question is, how do you manage it?
So how do you manage it? So I have a few tips how you can manage it. Number one, I think the biggest thing is being aware of what your triggers are. So knowing what you're allergic to. And if you don't know, then allergy testing can be helpful. Things like cockroaches, dust mite, pollen, and mold, as we already discussed, can all be big triggers of asthma.
You know, we were talking about it. It's a little stuffy here in the studio this morning. The AC doesn't seem to want to catch up.
Right.
Shelby, maybe you set it too low. I don't know. But anyway, the point is that you know, this is the time of year when you kind of get that summer feel, kind of combined with the sort of the spring mold and the pollen.
Exactly, and our humidity does not help because things just stick in the air. And so this hot and humid weather, along with the high pollen counts and the dust and the mold, it can be a nightmare for pollen sufferers and asthma sufferers.
Okay, Dr. Reena Mehta, thanks so much.